In this presentation, I would like to speak about quality dimensions to make everyone understand what we mean by this word quality in healthcare. This also will show the reasons that quality in healthcare is fast emerging as the central focus for healthcare policymakers and service providers. Among tens of definitions of quality, we chose the simplest one, which is to do the right things right the first time and every time. The first right is a choice taken by the responsible healthcare provider, and the second right is the way by which we achieve the goal or choice. For example, when we choose IV infusion to treat one patient, we should prepare the mixture and insert the cannula by the right way from the first time, because the repetition is considered as loss. Key dimensions of quality. Appropriateness, which means that the treatment given is the best for that patient according to the severity of the problem and health status of the patient, as well as evidence-based medicine rules. For example, the patient needs ICU services, should be admitted to ICU from the start, and a patient who could be treated as a day surgery should not be admitted to the hospital. Availability, which means the kind of medical service needed for that patient is available in a nearby facility all the time for all citizens, regardless of the language barrier, financial barriers, transportation barriers, or any other barriers. This dimension is related to the healthcare provider, his qualifications and experience to treat the patient in the best possible way. Continuity means that all kinds of services the patient needs are available in the same facility. If we need to send our patient to have some investigations or maneuvers in another facility, in a faraway facility, this is against the quality of our services. Efficacy, effectiveness, and efficiency. I meant to discuss these three dimensions together because many people mix between their meanings. The first one, efficacy, is like competency. That means our providers have the best skills and characters needed to treat our patients, but we are not talking about the care provider only, but we are talking about the whole team of providers in addition to equipments and materials. For effectiveness, it is related to the outcome of the service and whether it is the best for the case or not. On the other hand, efficiency is related to the cost of service. For example, if Hospital A and Hospital B could treat the same patient with the same outcome from all aspects, and the cost of this service is higher in Hospital A than in Hospital B, Hospital B is considered of more quality or higher quality than Hospital A. Prevention and early detection means that as long as the interventions made by the hospital could help to prevent the occurrence of health problem by identifying risk factors and trying to decrease it, this is considered of a higher quality service. Respect and caring. We consider a hospital service of high quality when all providers care about the patients and respect their beliefs and privacy and keep smiling all the time in front of them. Safety. In fact, I consider safety as one of the most important dimensions of quality. As long as the healthcare services are given in a safe environment and reduce all kinds of risk from hospital infections, medication errors, and so on, it is considered to be of a high quality. Timeliness. Services should be provided on time, without delays, especially in emergency departments. And when we try to decrease the waiting time in outpatient clinics, this raises the level of quality in our hospital. So healthcare services should be safe, effective, patient-centered, timely, efficient, and equitable. Equitable means the same all the time, especially during weekends, at night. We should be providing the same quality of medical service. Thank you.